are the Inc. 5000, the 5,000 fastest growing companies in America. There's also the Inc. 500, those who have achieved greatness. And we have Ashok Mathur. How you doing, Ashok?
Good, doing great, thanks.
Where
Evan.
are you in the Inc. 500? Because I know you've made it into that class.
Yeah, it's really great to be made there. We are top 5%, we are 269.
Wow. And with Patagonia Health. Talk about Patagonia Health. Where did it all start?
I was working for a large company and life was good. I was getting a big fat paycheck. Kids were doing well, but something was missing. So myself and my wife went to South America for 3 months, traveling, backpacking, slow travel. And somewhere along in the Patagonia region, which is Andes Mountains, beautiful place like Rockies, I got the inspiration that I got to come back and start this company, a cloud and apps-based company.
And so how many years ago was this? Because to get to the Inc. in the Inc. couple of hundred here, you are really growing fast.
We started in 2009, so it's about 6 years now.
Have you been in the Inc. 500 before?
No, this is the first time. Actually, we didn't know about it and we only applied this year.
Now you kind of know where you sit in this world. I bet you were shocked.
Well, yeah, you know, the thing is we were succeeding, we were working like crazy because we're growing, trying to manage the growth, but it was good to see where we are. It's good to know that we're in top 5%. Without that, you have no benchmark.
Were you shocked?
We're shocked and pleasantly surprised.
Right, exactly.
But shocked because, you know, we are in North Carolina and you think about Silicon Valley, companies always going up.
So then talk about Patagonia Health. What do you guys do?
We are an electronic health record software company for medical clinics. What that really means is it's a complete end-to-end software for managing your medical practices. So it automates patient registration process, it digitizes the all electronic charting, and improves billing for the practices. Now, you may be aware the federal government has mandated that all medical practices in the US must use a federally certified EHR. So Patagonia Health is federally certified. Mostly the people who use us are local health departments, community health clinics, and behavioral health agencies. You know, these are the people who really look after our community we live in. What their mandate is to keep the population of the county healthy. They're very passionate people. We are just enabling them to succeed.
What makes Patagonia Health stand out from other companies that may do this similar business?
Yes. Main thing for us is, you know, two things we stand out for. One, we have absolutely great product. And the second thing is we provide excellent service. In terms of product, you know, we were lucky when we started in 2009, the apps and the smartphones were coming out. So we built our electronic health record on apps platform. You know, we all have these smartphones, we all use them, love them. On this small device, you know, there are a million apps, but you bring the apps you need and the screen is not cluttered, it's not confusing. Whatever you want to do, you can do in 2 taps.
Right.
So we use the same platform. So if you're a nurse using our electronic health record software, you can bring the apps and widgets on your screen. You don't have to deal with all the other complexity. Just like in a smartphone, you can rearrange. So you can have the allergies, medication, problem list organized the way you want to work. So it is personalization of your electronic health record, but yet only 2 taps, you can do whatever you want to do.
So you used to be the corporate guy.
Yeah, big time.
And then you became now an entrepreneur.
Yes.
Do you prefer one over the other?
Yeah, I mean, the entrepreneurship is fun. It's full of risk, as you know. You don't always succeed. And if you have an idea, which is, you can't sleep, you know, you have passion for it, the advantage of the entrepreneur is you're working very, very hard, but it doesn't feel like work.
So when it comes to apps and app development, did you stop with one app or do you have a number of different apps for different applications?
Yeah, it's interesting you ask that question. You know, once you give people a apps platform, everybody has an idea, right? The nurses, the clerical support people, the health director, they all have ideas. So we collaborate with them, and with the apps platform, we can develop them very quickly. For example, you know, we collaborated with UNC Institute of Public Health. They said what would really help the local health department is if you have a health director dashboard. So we created a dashboard which gives you all the data about your health department, how your community is doing on your fingertip. For health department, it's been very, very hard to get the data out. Even small health department has the same power as a big corporation. They have the data which they need, very affordable. Another app we did is one of the Metro Health Department, which is a large one in the city. She wanted to have a GIS health mapping, so she wants to see how her community is doing, where the teen pregnancies are, where HIV cases are, where the flu outbreak is happening, so we map it then on the map. So you can see in real time how the outbreaks happen, and that really is very important for public health. Another one we did is clerical support people were getting tired of calling people for appointment reminders, so we built a communicator app within the EHR. It's very simple to use. You can send videos out to patients as well as patient reminders, so you can send a video, you know, flu season is coming, come and get flu shots. So we've done a lot of innovation in that area, which is really, really powerful and makes their life much easier.
Well, congratulations on number 269 in the Inc. 500 and Ashok. And listen, if that's not a great measuring stick of success, I don't know what is. The Inc. 5000, and here we have number 269 in the Inc. 500.